And Dr. Paws showed three things here. They control inflammation, they modulate the immune system, they stimulate regeneration, but they also provide energy to the cells. So for example, if you have, anybody had an infection and had an elevated white count? Well, when you get an infection, your white count goes up. Well, that happens, it's a miracle that it happens, because it happens within less than 24 hours. You go from having a normal white count to an extra 500 billion cells in your bloodstream that are there to help you fight infection. Where does the energy come from that? I mean, it's unbelievable. Well, the MSCs in your bone marrow divide very rapidly, and they donate their mitochondria, which are the things that make your cells that create energy, and they donate them to the HSCs and the progenitor cells that ultimately become those white blood cells. Without the MSCs, you wouldn't have an immune system. Without the HSCs, you wouldn't have an immune system, but they work together. So I've said this before, and I've been criticized for this, but I stand by it. I believe the majority of chronic illnesses are due to either a decreased number of MSCs and all stem cells, or a dysfunction of those stem cells, and resulting in increased inflammation. In my case, when I was in the hospital, by golly, I had some inflammation, right? My immune system was completely dysregulated because it wouldn't shut off. You have decreased ability to regenerate. So if people have osteoarthritis, guess what? You're not regenerating enough to repair the problem.